Hello.
Hi.
Hi, my name is Jess. I'm going to be your nurse today. I'm going to wash my hands. I'm going to I'm going to pull a curtain for privacy. And then can you tell me your name and date of birth?
Brenna Folkstead, 7/19/1981.
Perfect. Okay, are you comfortable the way you are? Okay, good. So I'm going to ask you a couple of questions. This is going to be your head to toe assessment. So I'm going to go over and just kind of look over your body and make sure everything's intact, okay?
Okay.
Can you tell me where you are today, Brenna?
Rasmussen College,
Okay, what's the date?
August 29th, 2019.
Perfect. And can you tell me who's the president?
Donald Trump.
Okay, good. So oriented times 3, and then dress is appropriate for age and gender. Speech is clear. Hygiene looks normal and good as well, and her posture is erect. So what I'm going to have you do, Brenda's going to have you stand up for me. I'm going to have you walk towards the board. And then on your way back, I'm going to have you do heel to toe. Alright. She is balanced, non-wobbly. And then what I'm going to have you do is put your arms at your side and close your eyes for me. Perfect. So balance is good. Gait is also good as well. And then I'm going to have you sit back down. Alright, are you comfortable the way you are?
Mm-hmm.
Alright, I'm just going to check your capillary reflexes. Good. So then less than 2 bilaterally on both hands. I'm going to check your feet as well. Less than 2 bilaterally as well on your feet. All right, so what I'm going to have you do is to have a little bit of range of motion with me, okay? So what I'm going to have you do is put your arms out and kind of do like a windmill backwards. There you go, and then forwards. Good. All right, I'm going to also do your feet. Have them stick out. Rotate your ankles for me. Good. And then put them back down for me, okay? And then I'm going to inspect for some edema, okay? So I'm going to palpate here. So warm, tender, non-tender, and no pitting edema. Also in your legs, warm to the touch, and no edema as well. Any tenderness when I do that at all? Okay. So equal and bilaterally, they have no edema in them. All right. So what I'm going to have you do next is that I'm going to do your tendon reflexes, okay? So I'm going to start with your upper extremities. So what I'm going to do is have your arm kind of placed against mine. So I'm going to check your triceps. Good. Good. Bilaterally equal. Then we'll also do your brachial. Good. Okay. Equal and bilaterally. Then I'm also going to do your radius. Good. Good. So both equal and bilaterally. And then I'm going to do your patellar. So kind of have your legs dangle off the ground a little bit. All right. Equal and bilaterally flexion is good. Then I'm going to do your posterior tibial. Good. Equal and bilaterally. I'm going to do your Achilles. Equal and bilaterally strong. And then also the bottom of your feet. Okay, good. Equal and bilaterally as well. Okay, how did that feel? Good? Okay. So what next I'm going to do is I'm going to check your pulses then, okay? So I'm going to start, hold your hands out for me, and check your radius. Equal bilaterally strong, grade 2. And also your brachial, equal bilaterally strong, +2. Good. And then I'm going to go behind your kneecaps, okay? So your popliteal, grade 2, strong and bounding, equal bilaterally. And then I'm going to go down here towards your feet. So I'm going to check out your dorsal pedis, equally strong, bilaterally, grade 2. All right. And then I'm going to do your, just kind of check your head and then your ears and your nose, okay? So I'm going to check your head first. No lumps, bumps, lesions, or parasites noted. Any tenderness when I touched at all? Okay, good. So what I'm gonna have you do is just take off your glasses for me. And I'm gonna check your pupils, okay? So just stare straight at me. Good. Good, okay. And then what I'm gonna have you do is look at those hangers over there. And then look at my pen. Perfect. So pupils were equal bilaterally, and they were also reactive to light, round as well, and accommodate to distance. And then I'm gonna check your up your nose as well. Okay, so if you look up for me, no deviation in the nose, moist and pink in the inside, no drainage noted. Then I'm gonna check your ears. All right, so no obstructions in the ears, mild ear wax. No obstructions, and mild earwax as well. All right, so I'm gonna check inside your mouth quick too, okay? So say ah for me. All right, so teeth are all intact and straight. There is no presence of tonsils in the back. Pink and moist in the mouth. And I'm gonna do a kind of a touching of your face quick too, okay? So what I'm gonna have you do is close your eyes, and then I'm gonna touch your face and tell me where I'm touching, okay?
Forehead, cheek, cheek, chin.
Perfect, so your cranial nerve 5 is intact, okay? So what I'm gonna have you do next, I'm gonna have you smile for me real big. Good, how about raise your eyebrows? Good, how about your cheeks? And frown for me like you're upset. Perfect, so your cranial nerve 7 is also intact, okay? And so what I'm gonna have you do next is follow my finger, okay? And just keep your head straight. Good, so your cranial nerve 3, 4, and 6 are also intact, okay? And I forgot to mention your sclera looks white and good too as well, and no drainage in your eyes, okay? And then I'm also gonna do another test on you, okay? So I'm gonna have you close the same eye as me, and then I'm gonna have you kind of let me know when you see my fingers, okay? Okay. Yep, scoop your other hand, there you go. And let me know when you see my fingers.
See 'em.
Okay, and then we're gonna do the other eye.
I see.
Okay, good. So your cranial nerve 9, 10, and 12 are also intact, and your cranial nerve 2 is intact as well, okay? And then next, I'm going to do a gross hearing. So I'm gonna have you close your eyes and tell me which ear you hear me in, okay?
Left.
Good. Right. Good. So that looks good as well. And then next, I'm gonna have you shrug your shoulders. Good. And then turn your head from side to side for me. Good. So your cranial nerve 11 is also intact, okay? And then I'm gonna just palpate your lymph nodes here on your neck, and okay? So underneath here is your submental, and then we have your submandibular, and then your preocular, and then your postocular, and then your anterior cervical, posterior cervical, your occipital, and then your supraclavicle, okay? Any pain at all when I touched? All right, so your lymph nodes are round, non-tender, soft, and they are movable, okay? So what I'm gonna do next is I'm gonna listen to your lungs, okay? So I'm gonna have you turn here. So looking at her chest, it is a 2-to-1 ratio, and there is no barrel chesting noted, no emphysema, and no use of accessory muscles, and non-labored breathing nor cough noted, okay? So if you want to turn this way for me, so spine does look straight on my watch here. And so what I'm going to have you do is that I'm going to put my hands above on your spine, and then once I start going down, say 99 for me, okay? I'm gonna check for your tactile femoris, okay? Ready?
99, 99, 99,
Okay.
99, 99.
All right, so that looks good. And I'm also gonna put my hands above on your back and I'm gonna feel for your thoracic expansion, okay? So take a nice deep breath. Good, okay. So next I'm gonna listen to your breath sounds, okay? So I'm gonna start on your back and then I'm gonna move my way to the front. So just take some nice deep breaths for me. Okay, I'm gonna listen to your side bottom here, on your right, and then also on your left. Good, all right, I'm gonna have you spin me around here. I'm gonna listen to your front, okay? So just breathe normal for me. All right, I'm gonna listen to your upper on your side here. Great, so breath sounds are equal and bilaterally, low pitch, clear and hollow, okay? So next what I'm gonna have you do is I'm gonna feel your carotid pulses. I'm gonna do one at a time, okay? All right, so carotid pulses are equal bilaterally, bounding, and then grade 2. And then I'm also gonna listen to each side as well, okay? No brute noted. And then next I'm gonna do your heart sounds, okay? So just breathe normally for me. All right, we're gonna start with your aortic. It is on your right side. It is in your second intercostal, right sternal border. And then we're gonna do your pulmonary, and that is your second intercostal space, left sternal border. Your Erb's point, which is your third intercostal space, left sternal border. Tricuspid, which is your fourth intercostal space, left sternal border. And then your mitral, which is gonna be your fifth intercostal space, mid-clavicular. And those look good. And next I'm just gonna check for your abdomen area, okay? So what I have you do is lean back in the chair. All right, so looking at abdomen, it is flat, non-distending. And then what I'm gonna do is I'm gonna listen first and then I'll palpate, okay? So right lower quadrant, right upper quadrant, left upper quadrant, left lower. All right. And then what I'm gonna do is I'm gonna palpate those exact same ones and let me know if you're feeling any pain, okay? Right lower, right upper, left lower. Any pain or tenderness? Okay, good. And then lastly, I'm gonna ask you, any changes in your bowel movements? When's the last time you went to the bathroom?
This
Had
morning.
a BM this morning? Okay, was it your kind of normal, or was it hard or soft or normal? Okay, brown in color? Yep, okay. And then what about your urinary? Are you peeing any blood at all? Any burning at all? And are you drinking enough water?
Yes.
Okay. I think that is it for my assessment. The doctor will be in shortly to see you. Any other questions for me? Are you comfortable sitting like that?
Yeah.
Okay, sounds good. I'm gonna go document my findings and wash my hands.